we were able to call upon a tremendous replacement. Many of you will recognize Ms. Denise Stokes from her public service announcements on the importance of condom use for sexually active persons. Denise is a member of the Presidential Advisory Council on HIV and AIDS and has been a tireless HIV prevention educator for 9 years. Ms. Denise Stokes.
Good evening, how are you? I want to also wish Steve Liu a very speedy recovery, and not only Steve, but also Terry Anderson, who I understand is sick at the moment. I hope that he's well very soon. He's also a member of President Clinton's AIDS Advisory Council. I have had HIV for 17 years, and at 30, that's more than half of my life. I remember having HIV before I got a chance to go to the prom, before I got a chance to go on my first date, before I was legally able to drive a car, before a boy could even call my house. I already had HIV. I remember that HIV took me from my middle-class home to being homeless, to being hungry, to being discriminated against, to being abandoned by my family, abandoned by society in general. And still I was supposed to make it. I remember that HIV took me a lot of places that I never thought that I would see. And those have been some very, very difficult years for me. And some of the best years of my life have been these past 9 years fighting HIV back. So I have a lot of memories about HIV, and some of those memories are, I remember when there was no place for people with HIV and AIDS in the American with Disabilities Act. We weren't included in that. I remember when we couldn't even utter the word without the threat of being banished away from society. Now we're included, but it's painful to know that we still need laws to make people respect our rights as human beings. And while many of us are engaged in the already unbalanced fight for our lives, the most tragic times that many of us have ever had, we're still being stigmatized and ostracized. I remember when we didn't even have AZT. For all practical purposes, we were treating HIV with painkillers. So basically the message was, die comfortably. That was the only hope that we had. Now we have a multitude of medicines. Even a whole new class of drugs has afforded us the opportunity to live and to live longer. But too many people still have no access to these drugs, people that I know and people that I love. People are being forced to be treated in clinics where they don't feel cared for just so they can have access to the drugs. Clinics where their names have been replaced with numbers that serve only as data for grant renewals. I remember when women died in silence because HIV was not their disease. Now there are women's groups and there are women's grants and there are opportunistic infections being recognized specific in women, but there's still no viable, affordable, female-controlled microbicides that could give us the ability to protect our lives. We need the ability to protect our lives so we don't have to die, silently or otherwise. Women are still not widely taken into account in the development of new drugs, so our precious bodies are the proving grounds for these drugs. Our voices need to be heard, and the voices of our unborn children need to be heard. I remember when the heart of the minority community was closed to the idea of HIV. Today we talk about it more and more, but those conversations are brief and few in the places where they count the most, like our churches. Today we have minority community-based organizations that have taken up arms and began to fight this disease with new weapons of peer education and culturally appropriate services. But those agencies are dying before they've had the chance to make a real difference. We don't need verbal support, we need money to keep our doors open and keep our clients alive. We need the technical assistance expeditiously, and we need the dollars consistently. I remember when addicts were not even thought of when it came to HIV prevention. It was widely accepted that if you became infected through drug needles, then you deserved to have it, or that reaching out to a community in need would somehow perpetuate their despair. Today, we are at least discussing that a life is valuable regardless of the details, but we need to do more than talk. A person need not die with one disease simply because they have another one. Needle exchange programs not only help prevent HIV, but they provide contact with counselors who can pitch the idea of addiction treatment and medical attention for those already infected. So let's stop telling addicts, who are our brothers and our mothers, that they don't count. If I had the opportunity to write the next 17 years of my life, which I'm sure I'll have, but if I had the opportunity to write that, my scrapbook would be very different from the memories that are already in it right now. I would have memories like needle exchange programs that save lives and prevent communities from becoming infested with HIV, and that carry a message that any addict can stop using, lose the desire to use, and find a new way to live. There would be minority community-based programs who do not have to choose between salaries for their peer counselors and their rent. My scrapbook would be filled with pictures of healthy, happy women who have control over whether or not they become infected, and even if they do, they would have some acceptable treatment options. Medicaid would be available to newly diagnosed persons, and then secondary prevention would be more than just a buzzword. But more than anything, I would like to see a picture of a group of us that are here today gathered at a reunion where we talk about a time when there used to be AIDS. I would like to see us sit around and have hors d'oeuvres and cappuccino and marvel at how politics and racism, classism, homophobia, and sexism no longer perpetuate HIV. I would also like to be able to say that I grew up with HIV in my veins, but I grew old in the cradle of a compassionate HIV-negative society. In closing, I want you to know that over the next couple of days, if you should get overwhelmed or frustrated at this conference, I would like to add a new spin to a quote that I heard earlier, and I would like to let you know that an ounce of prevention is the only cure that we have. Thank you very much.
For those of you who've never heard Denise before, I think that it's a powerful and moving message that she brings to us, and we appreciate you sharing it with us, Denise.